Hi everyone, welcome to our very first UbiSim webinar. We are so excited to have you here today. Just some housekeeping in the beginning. We will be recording the session today and we will be sending out the recording to all attendees afterwards. If you have any questions during the presentation, please use the GoToWebinar question feature and we will do our best to answer all of your questions at the end. So the subject for our webinar today is how to facilitate immersive VR simulations in nursing education. My name is Maria Dorico, and I'm the Director of Simulation and Scholarship at UbiSim. We're an immersive VR simulation platform for nursing education. In my role, I lead our content development team, so our simulation design and all of the research we do for the exciting features and equipment that we add to the platform. In addition to my experience at UbiSim, I've also spent years in nursing education and simulation education. And I'm also both a nurse and nurse practitioner and have cared for patients across the lifespan. And at UbiSim, we're a multidisciplinary team located across the United States and Canada. We're comprised of expert nurse educators and simulationists, 3D artists, VR software developers, and expert in the user experience and customer success. And we all collaborate together to bring our partner programs the best-in-class immersive VR experience for nursing education. So the objectives for today are we are going to discuss the benefits of immersive VR simulation in nursing education. We'll talk about how UbiSim prepares learners for the NCLEX and also how to facilitate engaging immersive VR simulations. Let's start off by talking about what is immersive virtual reality. So it's a multi-sensory experience where learners don headsets. And in a highly interactive VR environment like UbiSim, when learners put on the headsets, they're immediately immersed in a realistic 3D virtual clinical environment. So they can see that virtual environment in front of them, behind them, and to all sides. And this translates to a high degree of proprioception. And what that means is that the learner is able to feel their position and movement within that virtual space. And this ultimately leads to a high degree of presence. So the learners actually perceive that they're present in the virtual clinical environment, so much so that their presence often becomes disconnected from the immersive and the physical world around them. And so that's really important in immersive virtual reality because when learners do have that high degree of presence, they're able to suspend disbelief, focus on the authentic experience in front of them, and ultimately attain the learning objectives. So immersive VR simulation is an evidence-based modality, and there's a lot of demonstrated benefits in the research. These are just certainly a few examples of recent research that has demonstrated the benefits of immersive VR, and there's lots more out there. So for example, research has recently demonstrated that immersive VR simulation has comparable efficacy to high fidelity mannequin simulations. It improves cognitive, psychomotor, and affective skills, and VR learners are 4 times faster to train and 275% more confident in performing skills. Immersive VR simulation also provides a highly realistic environment, and that ultimately helps learners to bridge the theory-practice gap. As nurse educators, we know that the course content that we teach learners in the theory portion of the course, it's sometimes so hard for them to then transfer that robust knowledge and apply it in the clinical setting. So immersive VR really helps to bridge that gap. And immersive VR is fun, it's captivating, it's innovative, and it's empowering. And that's so critical because if learners are having fun and they enjoy the experience, they'll be motivated to put forth their best effort and ultimately attain the scenario objectives. So let's talk about immersive VR in nursing education. Where are we today? Well, VR is actually projected to increase from 10% to 45% over the next 5 years in nursing education. And what's really interesting is that this study was published before the COVID-19 pandemic. And we know that the COVID-19 pandemic certainly was a catalyst for more and more nursing programs to adopt immersive technology like VR. So we certainly expect and project that the use of immersive VR is going to continue to increase in nursing education, even beyond what we expected. And why are programs using immersive VR simulation? Well, we've found that immersive VR is really a scalable solution to many of the ongoing key problems that programs are facing today. One of those problems is increased matriculation. So nursing programs are seeing more and more qualified applicants applying to programs and have therefore increased their enrollment, which is fantastic because we have a global nursing shortage, and this will certainly help to mitigate that. But in addition to that, we also have a shortage in educators that are qualified to provide nursing education to these increased number of students. We are also seeing a decrease in clinical sites. So as nursing programs increase their enrollment, healthcare systems are really struggling to be able to provide clinical rotations to the increased number of learners. In addition to that, we see a wide variety of standardization in the education that students receive in clinical rotations. For example, students even within the same nursing cohort are going to have a wide variety of experience during those rotations. Some learners may go through an entire rotation without seeing patients with really critical and common diagnoses that they're expected to care for after graduation. And some might be in rotations where they're not able to do a lot of hands-on skills, so it's mostly observation. In addition to that, programs are turning to immersive VR simulation because they want to innovate and they want to engage their learners. And this is certainly not surprising because nurse educators and nursing programs have always been on the forefront of adopting immersive technologies and approaches to teaching. So it's expected that they would also be on the forefront of adopting immersive VR in healthcare education. And so all of these problems are culminating and leading to an increased demand for simulation, which is great because simulation is an evidence-based modality that provides standardized, high-quality clinical education. But simulation programs also face constraints in physical space and the number of qualified facilitators and debriefers that can educate students during simulation-based experiences. And so immersive VR simulation is really a scalable solution for simulation programs to increase their simulation offerings and serve the larger number of students. So the UbiSim experience, let's talk about what really sets us apart. So we are a very highly interactive VR platform. And something really unique about us is that we are built upon an intuitive web-based editor. And what that means is that we empower educators to use their existing nursing and simulation expertise to design VR simulations that are tailored to the specific objectives and outcomes for their learners. And when designing scenarios, educators can choose from diverse patients across the lifespan. And we also have a variety of clinical environments and equipment. And we do not have any menu-based interactions at UbiSim. We are a very interactive platform. And what that means is that when the learner, for example, wants to auscultate heart and lung sounds, they simply pick up the stethoscope from the supply cart, similar to how they would in real life. They would place the stethoscope on the correct anatomical landmarks and then listen to the authentic sound that comes through the stethoscope and analyze what it could mean. We also have very realistic communication. So when a learner wants to speak to a patient, a family member, or a member of the healthcare team, they do so in their own words as they would in a real-life clinical setting. So it challenges them to provide therapeutic communication and team-based communication. And we do not have any menu-based communication. So there's no menu or prompt that's encouraging the student to ask something that they may not have otherwise considered. UbiSim is also ideal for preparing learners for the NCLEX. All of our UbiSim scenarios are peer-reviewed and are based upon a robust needs assessment. During that needs assessment, we align the scenarios to the NCLEX test plan. We also align it to the NCSBN clinical judgment measurement model, and this ensures that all of our scenarios provide an opportunity for learners to go through the entire clinical judgment process, from recognizing cues all the way through to evaluating outcomes. So UbiSim scenarios are ideal for fostering the development of clinical judgment skills and prioritization in patient care, which are important skills that they will need to succeed on the NCLEX. UbiSim is also a highly realistic environment, and this ultimately translates to a realistic context for decision making. The research shows that the context in which nurses make decisions matters. And so in UbiSim, learners have realistic distractions and cues that they would realistically see in the real life clinical setting. And this really helps them to develop their clinical judgment and decision making. We also have unfolding case studies for our scenarios, and this presents the patient situation at a future vignette in time. And we also have next generation NCLEX type questions such as matrix multiple response and multiple choice, so learners can get more experience and confidence in answering those types of questions. So UbiSim is a standalone solution, and what that means is that when learners participate inside the VR scenario, they simply put on a VR headset and they have controllers in their hands. The headset is not tethered to a powerful gaming laptop, and that's great for programs. It makes simulation more scalable because without the need for a powerful gaming laptop, you save a lot on hardware costs. In addition to that, having just a standalone headset leads to a more immersive experience. When the headset is not tethered to an external gaming laptop, there's less signals of an external device in the physical world. And so the learners are better able to suspend disbelief and focus on the objectives. UbiSim also allows VR simulation from anywhere. So it's flexible. You can choose whether you want to do the simulation activities in the classroom, in the lab, or with learners at home. And not a large amount of physical space is required. You just need a 7-foot by 7-foot clear, safe space to participate in UbiSim activities. And also, UbiSim drastically speeds up reset time and sanitization procedures. For example, when a learner starts a VR scenario, that scenario is automatically staged and ready to go for the learners. If they switch to a different scenario, that scenario in turn will also be immediately ready to go. So you don't have to reset a simulation suite, put out any new equipment, or anything like that. In addition to that, it's a lot easier to sanitize the headset. It's very quick and efficient. You don't have to sanitize a whole simulation suite or physical equipment. So now we'll talk about structuring a simulation day with UbiSim. And this is just one example of how you can structure your simulation day with Immersive VR. What we talk about today is aligned with the NACSL Healthcare Simulation Standards of Best Practice, which we follow at UbiSim, and we always recommend our partners are familiar with because it really guides you in establishing a structured activity that's going to help your learners improve their practice moving forward. So to start the day is the pre-briefing, and that includes preparation activities and the briefing. Then the learners complete the VR simulation scenario. They have an opportunity to debrief and reflect both on the experience and beyond it as they identify key takeaways to improve their practice. There's also post-simulation quiz and unfolding case studies. And you can also have your learners complete post-simulation activities such as concept maps or documentation exercises. And you can notice here that the VR scenario is really only just one element of that structured simulation-based experience. And that's what we really provide at UbiSim. We provide the high-quality, peer-reviewed, excellent scenario. And in addition, we also provide a very structured and robust simulation-based experience. To start, we'll talk about the pre-briefing and the preparation activities. And these are built into the UbiSim platform. So as educators, you really have the confidence in knowing that when you assign your learners a scenario, they will immediately have access to these structured preparation activities. That includes reviewing the learning objectives, the scenario introduction, which can be structured as a change of shift report from the nurse, or a triage report if the scenario takes place in the emergency department. Learners can review and research anything in the patient's chart, such as lab results, X-ray images, or the EMR, and they can also look at medications that are available in the medication card. And educators have the ability to curate the preparation activities to their course content. For example, they can add in course readings from their textbooks. Educators also have the ability to customize the level of information available to the learner. At UbiSim, we understand that as the educators, you know your learners best. And so if you have a more advanced learner and you feel it's appropriate for them to have access to a little bit less information, you're able to completely customize that. Now we'll talk about the briefing. So this is absolutely critical for establishing psychological safety. And we do a lot of the briefing at UbiSim for your learners. It's about establishing ground rules and expectations, such as the role they will take on in the simulation, how long that simulation will last, and also providing an appropriate level of detail before they participate in the simulation. Orientation to the VR clinical environment and equipment is critical so that the learners have confidence and they understand how to interact with the environment. And immersive VR in general, and especially with UbiSim, is very intuitive, but we also have a robust library of tutorial scenarios for the learners to complete before they actually complete their first clinical scenario. And this image here shows, it's an image from one of our tutorial scenarios where it guides the learners on how to organically pick up the stethoscope and place it on the correct anatomical landmarks to auscultate lung sounds. So next we will talk about facilitating VR scenarios, and we'll talk about 3 facilitation methods today. That includes faculty-led, peer-to-peer, and multiplayer. Faculty-led is the facilitation method that most closely mirrors traditional simulation activities. As you can see here in this photo, there's a faculty member that's sitting behind the laptop, and her main role is to observe the simulation and trigger standardized patient dialogue in response to what the learner says. And the reason why that's her role is because in UbiSim, we do not have that menu-based communication. So the learner gets to communicate in their own words, and the faculty member already has the dialogue readily available and can immediately trigger responses. Then we have the learner, that's the active participant. So she's wearing the VR headset, has controllers in her hands, and she's going to provide care to the virtual patient. Seated at the desk are actively engaged observers. So they are watching the simulation unfold, they're taking notes on what's happening, and they're identifying topics that they would like to unpack further during the debriefing session. What's great about faculty-led is that it easily accommodates small and large groups. As you can see here in this photo, the view of the simulation is projected onto a larger screen. So you could have a large number of observers watching, or you can even project this onto video conferencing if you have learners that are tuning in remotely. Next is peer-to-peer learning, and this is really a favorite facilitation method among our partner programs. And the reason why is because it's a very scalable and standardized approach to facilitating simulation that also uses faculty resources judiciously. And how this works is learners collaborate to achieve the simulation objectives. They work together in peer groups and they switch roles between the scenario. And using a group of 2 students as an example, there will be one student that's the active participant. So they're wearing the VR headset and they're providing care to the virtual patient. And then the other student will be triggering standardized dialogue in response to the learner's communication. And we have safeguards in place for standardization. So the learner that's responsible for dialogue only has access to the dialogue that makes sense during that specific time in the scenario. Peer-to-peer learning is a great strategy for fostering active learning in your nursing program. It empowers learners to provide constructive peer feedback and support, which are critical elements and skills that they will need as nurses. Then after they each do a role once, they flip and they get to do the opposite role, which is really great because they're able to experience the other side. They can debrief between rotations of the scenario, and they get to really have a robust learning experience. Something really interesting that we found with our partner programs is that some of them use peer-to-peer learning in a deliberate practice model. So when the learners switch roles, they don't do a different scenario. They actually do the same scenario. And the collective goal is that with debriefing and discussing it amongst each other, that the second performance in the simulation will be improved as they optimize and work together to improve care of the patient. The final debriefing strategy we will discuss is multiplayer. And multiplayer can certainly be done in a faculty-led model or a peer-to-peer model, but we separate it out because there's some key features that you can use when you're facilitating scenarios. So multiplayer allows groups to collaborate within the same scenario, and our multiplayer experience is highly interactive. So learners have the same shared advantage. They're able to hand each other objects like stethoscopes and pen lights. They're able to talk to each other in real time or communicate with the patient, family member, or healthcare team. And they can even divide up tasks as they optimize care of the patient. For example, one learner can do a physical assessment while the other learner explores the electronic health record and identifies any APRN medications or standing orders that they could implement to improve the patient's condition. Multiplayer is a great option for developing teamwork and collaboration skills, which is critical because in healthcare, we know that teamwork and collaboration equals better patient outcomes. So it's so important that we teach this in our nursing programs. Multiplayer also allows observers inside VR. So what that means is that learners, instead of observing from a computer screen, they put on a VR headset and they get a front row view to watching the simulation unfold inside VR. And to maximize fidelity and realism, any observers inside VR remain invisible to the active participants. And this is a really exciting feature because research has shown that observing from inside VR more closely mirrors active participation than observing from a computer screen. In addition, faculty members could also join learners inside VR. For example, if they want to go through a physical assessment together, they're able to do that with their learners using the multiplayer feature. When selecting the facilitation strategy, programs have so many options that can really best fit their needs. So when thinking about a facilitation strategy that would work best in your program, it's important to consider the level and needs of your target learners. For example, if you have novice learners that are completely new to nursing practice and simulation, you may want to initially start off with faculty-led so that you can have a more hands-on approach over the simulation activity. A lot of programs are having constraints in space and resources, and if that's the case, then peer-to-peer learning is an excellent scalable option because it allows you to have scalable simulation activities while using faculty resources judiciously. Also, the simulation objectives and outcomes are important to consider. For example, if your simulation activity is focused on deliberate practice, then peer-to-peer learning would be a great option. Or if you're focused on team-based learning and collaboration, then multiplayer would be great. And then of course, time. That can always be a constraint in nursing programs. So if you are faced with time constraints and you want to get a lot of learners through a simulation activity, then peer-to-peer learning and multiplayer are great options. When analyzing the facilitation strategies, in summary, every strategy has benefits. So faculty-led is great for novice learners. It more closely mirrors traditional simulation activities, and it's for faculty that really want direct involvement over the simulation. For peer-to-peer learning, it's scalable and uses faculty resources judiciously. It also is excellent for supporting a deliberate practice model and empowers peer feedback and support. For multiplayer, it's excellent for teamwork and collaboration. You can pair senior and novice learners together so that they can learn from each other. It allows for observation inside VR, and faculty can also join learners inside VR for that more hands-on approach. After learners complete the VR simulation, they are immediately guided to a structured debriefing session. And our debriefing session consists of a curated and customizable feedback report. And here on this slide, you can see a sample image of what that report looks like. So the software automatically captures the critical actions the learner performs and any performance gaps that they make during the simulation. And then it provides evidence-based constructive feedback on the critical action or performance gap so learners can understand the why behind whether that action was supposed to be done or not supposed to be done. In addition to that, they also have access to self-guiding questions, and these are based on the PEARLS debriefing framework. So learners can reflect on the experience as well as beyond the experience as they identify key takeaways that will improve their practice moving forward. In addition to that, the learners can complete post-simulation activities such as a quiz and unfolding case studies with NCLEX type questions. And faculty can also choose to assign additional activities such as concept maps, documentation exercises, or any reflection journals, just to name a few options. So ultimately, it's a very robust debriefing structure, and which is great because we know that debriefing is a critical component of the simulation-based experience. So in planning for success, it's important to remember that immersive VR simulation is an evidence-based modality with established benefits in the literature. In addition to that, it will prepare your learners for the NCLEX because it really is ideal for fostering the development of clinical judgment, prioritization, and decision-making. When thinking about immersive VR in your program, there's so many options for facilitation strategies, and there's one that will fit your needs, both for your program and for learners, as well as for your faculty. And it's also important to remember to have fun, because if learners enjoy the experience, they will be motivated to put forth their best effort and ultimately attain the objectives. So thank you for attending the webinar. Here is my contact information. If you have any questions about UbiSim or immersive VR simulation and nursing education, please don't hesitate to reach out to me. And now I'd be happy to take any questions.
Thank you, Maria. Thanks everyone for your involvement. We have lots of great questions. We'll try to answer them all today. So students' orientation, would you suggest running the orientation on the same day of the simulation activities or on a different day?
Yeah, that's a great question. So the great news is that you can do it either way. While it's often nice to have a dedicated orientation day, we know that nursing programs, often the courses and the simulation schedule are packed and you're not able to do that. So you can absolutely orient learners on the same day. What we recommend at UbiSim is assigning learners resources ahead of time so that when they come for the orientation day, they really just need to put on the VR headset and do some of the tutorial scenarios to get used to the technology. So at UbiSim, we have a robust knowledge base that's available to learners, and there's onboarding videos and all types of resources so that they can really understand what the platform's about. And if you're going to be assigning a clinical scenario, also ensuring that they have an opportunity to complete the preparation activities so they really know what's expected of them that day.
Thank you, Maria. I'm sorry, some of you are raising your hands, but I am not, for some reasons, I am not able to allow you to be with us. So my apologies about that. I will read then another question that will get better for the next webinar. What are the most common challenges faced by programs adopting immersive VR from your experience?
Yeah, so we see a lot of common challenges when programs come to us looking to adopt immersive VR. A lot of them are having increased enrollment, and they also don't have the increased budget to hire more faculty. So they really are challenged with providing high quality clinical education with existing resources to a growing student body. And so they come to us because immersive VR simulation really solves a lot of their key problems and challenges. They're able to scale their simulation activities with high quality evidence-based scenarios and provide that structured simulation-based experience. And also, their simulation programs are very busy. They often have constraints in physical space. So the ability to really do VR simulation from anywhere, they can move it to the classroom, or they can have learners complete it remotely. It's very helpful for them. They just need a 7-foot by 7-foot clear space, and they're able to have a high fidelity simulation experience. And also, in addition to that, they are looking for ways to engage their learners and making sure that they have fun when they're learning. And they found that their students really enjoy immersive VR. It's engaging, it's exciting, it gets them looking forward to their simulation day, and they ultimately have fun and are motivated to attain the objectives.
Thank you, Maria. We have a question from Gloria. Can this video be sent to the participants on the call today? Absolutely. So we will be sending you a follow-up email with a recording of our conversations today. Another question is, are scenarios customizable to other contexts, for example, in Europe?
Yeah, that's a great question. So UbiSim is a global company, so we have partners located all over the world. And so, yeah, it's absolutely, you can customize them. There's, of course, limitations with that, but we have our partner programs throughout the world that are designing scenarios and customizing them and providing really curated simulation experiences for their learners.
Perfect. Then we have a question from Belinda. Did I read somewhere that mentions the need for a Facebook account? I think you're referring to the setup of the Oculus headset. So we'll actually be able to address these questions, these like tied up with the hardware in a follow-up email. So feel free to reach out to us on support@ubisimvr.com, and we'll be very happy to answer all your support hardware related questions. Thank you for that question. Have you had customers that needed to complete an institutional review board review to implement VR scenarios? That's a question from Tiffany.
So, to my knowledge, we have not had programs that have had to do an IRB approval for scenarios, but if they're looking to conduct research, then of course they would need to go through the proper IRB protocol at their institution. And Gautier, from the sales and customer success side, I don't know if you've seen that on your end.
I will have to check with the team, but I do not think so. I'm reading. Thank you for all your questions. We have a lot of great questions here. So that's more of a comment on from Will on the students orientation. We do first steps from Quest, which is an application you can find on your Oculus wireless headset, and then we run the adult room orientation as their first interaction. So yeah, I'll answer that one. I think Will is referring to our tutorials, which is something that has worked very well for some of our partner programs who have been implementing these as part of their students orientation. Another question from Daniela. Thanks, Maria. This is very exciting. My curiosity is about the mental health psychiatry scenarios in the database. I would love to learn more on this.
Yeah, we have mental health scenarios available on the platform. For example, we have one scenario where the patient presents with signs and symptoms of major depressive disorder. And we have found that mental health is a great subject for immersive VR, because when learners go into the clinical setting, they're able to see facial expressions and they feel like they're really there with the patient, and they can see their affect and their disposition. And so they really are able to buy into that authentic patient presentation and then focus on the mental health objectives. And we also have partner programs across the world that are developing mental health simulations with our platform. So absolutely, it's great for mental health, and it's really exciting, the potential for mental health simulations with immersive VR.
Thank you, Maria. We have another question from Madhu. Is the instructor facilitated training mode remote?
Yeah, so you don't have to be in the same physical location with the learners to facilitate the simulation. That can absolutely be done remotely.
Thank you. Are there any plans for other language options? On that, Maria, maybe you can say a few words about not only the availability of a different language on the platform, but the customization of the communication piece in UbiSim and why partner programs in Australia, in Canada, and in the US and in other countries are using us.
Yeah, so what's really great about the dialogue piece in the simulation is that you're able to completely customize that. So you can record dialogue that's in authentic accents or in whatever language that you want. And then in addition to that, with the platform, Gautier, you can maybe speak to this, but how our programs that are using different languages are using the platform as well?
Oh, yes. I mean, in terms of the languages of UbiSim, so the platform is available in 3 languages, English, French, and German. Now, when it comes to the communication, as Maria just mentioned, you can really record yourself and record the communication prompts yourself through the editor. So that really allows a lot of programs in a lot of very different markets and countries to actually take control of communication and have that customized to their needs. So I'll continue because I'm conscious of the time, and we have also a lot of great questions. Thanks everyone. Do you also offer procedural trainings in VR for nursing technical skills like intravenous blood puncture? That's a question from Dita.
Yeah, that's a great question. So with Immersive VR, they have controllers in their hands. And so the controllers are really extensions of their hands in that virtual environment, and they do limit fine psychomotor movements. So when looking at Immersive VR as a simulation activity, fine psychomotor movements like inserting an intravenous like an IV catheter or a Foley catheter, it's not ideal for Immersive VR because they're not going to be able to use their fine psychomotor movement of their hands. But what it is great for is for cognitive aspects of the procedure, for knowing that they do need to insert a Foley and inserting that in VR, or knowing that they do need to do some type of intervention, and also the effective part of it. So how they would talk to the patient before they insert a Foley catheter, for example. But what's great about Immersive VR is that you can focus on the cognitive and effective aspects when training for procedures, and then leverage that technology for that part, and then also use it in a hybrid model with mannequins or task trainers that many are already using in their simulation programs, which really are ideal for teaching fine psychomotor procedural skills.
So we have a question from Vimbai. Does UbiSim offer a step-by-step guide sheet for running the scenario?
Yeah, so when running the scenario, something that's really great is that they are all standardized and set to unfold based on predetermined learner actions and decisions. So they're not on the fly, and you have confidence as an educator that no matter which student starts that simulation, it's going to unfold in a predetermined way. But of course, as faculty, you are able to view all elements of the simulation, so you know the critical actions the learners are expected to perform, the learning objectives, and we also have a special section in the editor for just faculty to read more information about the simulation. So you have a lot of resources as well.
Thank you, Maria. Another question from Nino. In which study year would you suggest using UbiSim VR? Thank you.
I'm sorry, in which what?
Study year. I mean, in which perhaps I think would you suggest using UbiSim with first-year students, more senior students? I think that's what the question is pertaining to.
Okay, yes, absolutely. So UbiSim can be used across the nursing curriculum from the very first day fundamentals all the way through to when they're graduating. Immersive VR is very intuitive. We have scenarios on our platform that are meant for the novice fundamentals learners all the way through to the more advanced learners. And so it's really great to introduce them to simulation early on in their nursing studies, because it's something that they're going to see throughout the program after they practice, when they're practicing nurses doing trainings. And it really is a standardized, structured, evidence-based way to provide clinical education and improve their practice. So we recommend it across the curriculum.
Thank you, Maria. Another question: what aspects of a scenario can you modify using the editor? Well, very briefly on that one, because there's obviously a lot that can be done thanks to our web-based editor. But yes, if you could answer that.
Yeah, so our web-based editor really allows you to modify virtually almost every aspect of the simulation, I would say. And you can decide as faculty, based on your bandwidth, how much you do want to customize. When you purchase UbiSim, you have immediate access to our pre-made scenario library of peer-reviewed, evidence-based scenarios. You also have access to a rich community sharing library, which are scenarios that our partner programs have designed themselves and shared with the rest of the community. But if you do want to customize and create your scenarios, the editor makes it so easy for you. It walks you through the process. You can spend a very small amount of time to customize a simulation. So maybe you can just change the patient or change some aspects of the diagnosis and some elements of the care, or you can create your own from scratch. So it really is the best of all worlds. Based on the time that you have available, there will be an option for you.
Thank you, Maria. We've got a lot of questions and we're not going to have time to answer them all, but these are great questions. So thanks everyone again. We will answer them. The ones that we won't be able to answer today, we'll be answering them one by one in our follow-up email. So with faculty-led, requires a faculty to run the simulation on the fly?
So the answer to that is no. All of our scenarios are standardized. In the design process, we determine the learner actions and decisions that would move the scenario from one state to the next. So it's not on the fly, it's standardized, and faculty have the confidence knowing that it's going to unfold in a set way regardless of the learner. And in addition to that, they're able to really focus on observing the simulation and also triggering the dialogue in response to the learner.
Perfect. Can you elaborate on the peer-to-peer model? Can there be more than 2 students working together?
Yes, absolutely. So there's so much flexibility in the size of peer groups that you use for the peer-to-peer model. In my presentation, I used the example of 2 students, but we have partner programs that are very successful in using 3 students, for example. And any student that they have added on from the original 2 can be actively engaged observers. So they can watch the simulation unfold and they can identify topics that they want to unpack further in the debriefing. And then they can also rotate, of course, through being the active participant and the learner that's triggering the dialogue. So you can really decide on, based on how many learners you have that need to have simulation activities that day and your time, what peer group size really works best for you.
Thank you. And the last question for today from Tiffany: are all responses set by the programming, or can there be customized responses to questions the nurses may ask?
Yeah, so in our pre-made scenarios, the dialogue is all set and ready for you, but you do have absolutely the ability to customize that dialogue further and add responses into the simulation. And something that's also helpful is that, of course, the learners may sometimes ask an unexpected question. So we have automatically built-in responses that are designed to cue the learners and get them back on track if they were to ask something unexpected.
Thank you, Maria. I see it's 3:44. We have 1 minute left for another question. Yes, the webinar is recorded and we will be sharing that with you. And that's actually, we are coming to the end of our webinar together.
All right, well, thank you everyone for attending. This was our first UbiSim webinar, but certainly will not be our last. We plan on doing this on a regular basis. So please stay tuned and have a wonderful day.